Hello, welcome to Eugene's Speech Language Therapy. I'm Sierra, and this week I am talking about voice disorders. This week I got a question from someone whose initials are RH, and she asked me what she could do about her voice because she's been in speech therapy. It's not improving the way that she wants it to. She had a stroke, and she wants to know what else she can do. So I suggested she see an ENT, and that's what I'm going to talk about this week. If you go see a speech therapist because you're having difficulty with your voice, maybe it's breathy, maybe you feel like you have to strain, people might ask you to repeat yourself more and more. Maybe you had a stroke and your voice changed after that. You're quieter, or it's gravelly or harsh sounding, or maybe it has pitch breaks. Your speech therapist might suggest that you see an ENT, ear, nose, throat doctor, or otolaryngologist. This is someone that I use a lot in my practice. So when I do a voice evaluation, there's only so much that I can know. I can have you do different things with your voice and kind of see what the range is, and I'm using my ears to try and figure out what's happening in your body. However, if you go to an ENT, they can do this great assessment that uses, it's called video laryngoscopy, and all it is a little tiny camera on the end of a tube. They use a local anesthetic, a little spray usually, to help numb the tissue, and they'll put the camera up through your nasal cavity, and then it'll hang back at the back of your throat and look down on top of your vocal cords. And so what it'll look like is if these two are your vocal cords, normally when you talk, they come together to vibrate. But if something's wrong, it'll show it. Maybe you had a stroke, maybe there's some paresis, and one of them just stays open a little bit, and that way they don't have good approximation and it sounds harsh or whatever it's doing. And so it just gives you a clear view of what's happening in your larynx. It shows us how the anatomy is functioning during different speech activities. So if you're experiencing a change in your voice that you can't fix on your own, go find a speech therapist, ask him or her to get you in touch with an ENT so that you can be diagnosed, and that person will be able to use that information to treat you more appropriately. I hope that helps. Thank you so much for listening, and check back next week. Bye-bye.